I've had a very tattered relationship with medication. It's not my favourite part of the journey. Often when you're in the acute setting in the hospital, which is where I was, they don't really talk about other aspects like how are you going today, or it's like here's a medication, take it. Medication for me really represents from people a certainty that if you take this you'll be well. And I don't believe that that's all you need to do to stay well.
So I had to do what was told, otherwise I would be put back into hospital. It was like I was in jail within my own body anyway, but then I was also in jail with what they were telling me. So I was outside but still not free. And I really wasn't in the right headspace to remember too much of it because you're a little bit like a zombie, I suppose you could call it.
No one wants to see their child diminished, She was a very smart person. She was very clever. She had tremendous political wit. I mean, you should have seen her political cartoons. I mean, they were really a joy. And then you see them being diminished bit by bit because of a medication.
First key issue is that medication should very rarely be the first line option. So definitely for mild to moderate mental illness, first line option should be looking at how your lifestyle, things you're doing, not doing. It also means looking at what sorts of talking therapy you might be comfortable with. Clearly, sometimes some people are not comfortable with talking therapy, and that's legitimate as well.
The evidence would suggest that psychological therapies, interpersonal therapy, more psychodynamic-based supportive therapies, those sort of approaches I think are really first line. People with the more severe end, so severe spectrum of illness, using pharmacotherapy, you would consider it earlier.
There's never one right medication. It's always the right medication for the person, for a purpose. Actually, what is best for a person is very much dependent on that person and their desires as well as the illness they've got.
To me, medication represents the whole clinical process of psychiatry, of hospitalisation, of the whole process. It kind of ties in with that. Taking medication every day means to me that you need to rely on something to be well. And so what if that thing wasn't there? Does that mean you can't rely on yourself to be well? And I think the impact of knowing you need to take something forever or indefinitely is really scary.
She became very toxic, often on medication. So we lived with a lot of very severe side effects. She had quite significant weight gain. She had breast milk. She looked 6 months pregnant. Menstruation had stopped. So there was all those very severe hormonal impacts.
I suppose it held me down a bit, it felt like to me, because I had to do the monthly blood test. I had to make sure I was available to do that. It also makes you tired, the weight issues and also heart problems, and I've had a heart attack and I've got tachycardia, so they really had to monitor that.
So if you try to see it from the consumer's point of view, when adverse events occur, that they're actually able to be appropriately managed and being responsive enough to see when things change, that you need to step in and play a role.
Medication for mental illness is the same as medication for any other illness. There's side effects as well as benefits, and so it's being able to have that conversation up front about the fact that there are risks as well as benefits, and discussing with a person which risks they're prepared to take.
Trying to make sure that my patients feel comfortable having those discussions with me is a very important part of making sure that the right person gets the right medication for the right length of time. It's not just about the mental illness, it's also about the whole person care.
Unless each person who's prescribing actually is aware of the range of problems a person has, be they physical health problems, social problems, mental health problems, and the medications they're on, then things are likely to go wrong. In terms of how do collaborative roles work best, the key thing is having clear communication and agreeing what the roles are. Because there's many ways of working best, but none of them work well unless you communicate.
And I think at the moment, unfortunately, it does tend to be fairly fragmented. One of the sort of themes that tends to come out is that they have to repeat their story time and time again to individuals, and that becomes a very tiring process, can be a very re-traumatising process.
There was all this lack of continuity. You never knew who to speak to, just not working in a team.
Yeah, I think one of the things that needs to be in place to enable a consumer to get best possible care is that complete medication regimes known to your providers, and also the goals of therapy, that the intention of the treatment plan is actually communicated.
They are very reluctant when I've told them in the past I want to get off medication. And I ended up bringing my husband along to an appointment, and I said the same thing to them, and then they changed their tune. They said, oh, okay, well if your partner's here to support you, okay, we'll look at reducing the medication. I was upset that it took that. Not everyone knows that they have a voice or they have a choice.
I liked going to see the psychiatrist. She actually showed empathy. She would remember everything, where she would obviously make her notes after the appointment. So I suppose when you're schizophrenic and they're writing in front of you, it doesn't really help. I didn't mind just opening up and talking to her, made me feel comfortable to just talk and not want to hide anything from her.
When it's a team, when you're actually, everyone's equal, there's kind of this open dialogue. To treat her with respect and give her a very clear role in the decision making, that is incredibly helpful.
Almost all the actual care is provided by the consumer themselves and their carers. What we're really doing in the longer term is empowering consumers and their carers so that they can recover.
I can look back and go, it's come in handy when I have been unwell, because it has gotten me well a lot sooner than I guess if there wasn't any medication available.
Medication was a big part for me, obviously. It did help me, but there is no one solution. I don't think for every single person with mental illness. She actually wanted to help me get off the medication, which was brilliant. So I'm like, let's give it a shot. It took 3 years. It's been nearly a year now, so with no meds.
We need to be treated as equals. The consumer has the lived knowledge and the lived experience, and those are equally as important.